apologies for the late submission. I just want to give you a heads up. I'm having a pretty bad flare-up of my asthma, so if you see me just deep breathing or getting a little bit dyspneic, it's just because it's just my asthma, so apologies in advance. Sorry. So this is regarding a 75-year-old male seen for a routine physical. Veteran has no acute concerns, denies any pain at this time. Past medical history: neurogenic bladder, macrocytic anemia, dementia, vitamin B12 deficiency, open wound of the shoulder region, GERD, myasthenia gravis, pes planus. Okay, that's better. Multiple sclerosis, oropharyngeal dysplasia, acute seborrheic dermatitis, psoriasis, chronic angle closure, glaucoma, hyperlipidemia, dementia, allergies, hypertension, depression, seizures, convulsions. He does have an allergy to wool. This was a little bit more of an extensive head to toe, so just a FYI. Review of systems: general, denies any chills or loss of appetite. Respiratory, denies any shortness of breath, denies difficulty breathing or pain with inhalation, exhalation. CV, denies any chest pain. GI, denies any abdominal pain, nausea, vomiting, diarrhea. Neurological, denies any headache or numbness or tingling. Psychiatric, no changes in mood or behavior. Physical exam: so the veteran is an elderly male with a past medical history of MS. Veteran is bedbound with bilateral upper extremity movement and limited. So he has upper extremity full range of motion, but limited bilateral lower extremity movement. We did head, eyes, HENT, head, eyes, ears, nose, throat. Mild seborrheic dermatitis on scalp, but there's no redness or bumps on scalp. Pupils are 3 millimeters, round, reacted to light. Peripheral visual fields and alignment intact. No redness, drainage, sclera white. There was mild cerumen build up to bilateral ears, but there were no hearing changes. Angel, I'm recording something. Give me a second. I'm recording something for school. Give me a second. No nasal discharge, no post-nasal drip, tonsils were present, no redness. Angel, put that low, I'm recording. No redness or swelling observed. Respiratory-wise, he had a mild cough, but it was dry. His lungs were clear to auscultation, no rales, bronchi, or wheezing. Cardiovascular, heart sounds were present, apical pulse was within normal limits, and no murmurs were heard. GI, he does have a history of gallbladder issues. So he had it was tender with palpation on the right lower quadrant and right upper quadrant area. No abdominal distension. Belly was soft and flat. Bowel sounds were present. Genitalia, the right and left testes were present. No inguinal hernia. No redness, lesions, or discharge were present. And the veteran is circumcised. Neuro, he's alert and oriented ×2. And no changes in baseline upper or lower strength. Integumentary, he has his left first digit toe endorses pain with palpation. There was redness and a fungal infection of the nail that was noted. The nail bed was yellow, and you could see significant skin breakdown around the nail bed. And during my observation, I noticed that on the sacral wound, he had underneath the mepilex, there was a sacral wound the size of a nickel, and to me it looked like a stage 2. I couldn't get that close up to it. Psychiatric, he was calm and pleasant, no behavioral disturbances. Then we go through his medications. But the assessment and planning was interesting for both parts. We went through the sacral wound. So we referred him to wound care for the wound care nurse for staging, and the sacral wound dressing per order. So there was an order already in there for the mepilex. Interestingly enough, today we followed up, and she had mentioned that he actually has a stage 3. And interestingly enough, it was nice to kind of go back because, sorry, I'm losing my train of thought. Pat had done her assessment earlier this week. So she kind of knew that this patient was going to be a good patient just to look and do a head to toe. She missed the stage, the wound, not the stage. She missed the wound that I found, and she thanked me the day before. She thanked me on yesterday, saying that I actually had saw him and I did not notice it, and it was hard for her to do it on her own because she didn't have anyone in the room to check that area. So she was thanking me, and she trusted my judgment, which was nice. Also, the left toe, first digit fungal infection, when I was looking at it, and I said, this looks like it's athlete's foot, as well as the toenail infection. So she ordered clindamycin to start, because he wasn't getting anything for that area. So again, it was just nice to kind of see that, the observations that I had made, were able to kind of cue for treatment for the patient, which was just nice to see. And just to see that as far as my assessments are, I feel like they're getting a little bit thorough, with just going through as far as a complete head to toe, and also just as far as the next steps. So assessment and planning, we've been working on a lot. So overall, I feel like I'm improving. I feel a little bit more confident, which is great. So again, apologies for the late submission. And I will send you an email shortly to update everything with the hours. Everything will still be finalized by the 19th, and everything will be all signed up and squared away. Thank you, Professor.